So we have a few minutes for question and answers. This is a bit shorter than we anticipated. And before we then have the closing remarks by Madame Michelle Rivasi. So I will start posing three questions, one each to our experts. And the first question, and that's maybe best to you, Marion, is can you give us some more detailed results of the effects of mistletoe treatment? And the second question, I think maybe it goes best to Klaus, is does the integrative approach offer a distinct vision on the primary prevention of cancers and potentially other non-communicable diseases? And the third question to Thomas is about that's more related to Germany and the medical councils. There's some discussions also against integrative medicine and excluding some of these activities. And how do you see this, some of this critique in the light of the experience you've had now with the competence network? So I give each of you maybe a minute or two, I know it's short, to give your answer. Thank you.
Well, starting with evidence on mistletoe treatment, there are various levels of evidence that have been found. So we have an increasing amount of randomized trials. The last really good randomized trial was on pancreatic cancer, with 2 more confirming trials going on at the moment in Sweden and Eastern Europe, and which show a survival benefit for mistletoe, but as well a significant survival benefit in locally progressed pancreatic cancer, but also less consumption of painkillers, less fatigue, less loss of appetite, less loss of weight. Then we also have meta-analysis of different kinds, showing that the quality of life is being increased with mistletoe, and there are cues that mistletoe is also prolonging life. We have impressive single case studies, and we also have randomized trials showing that mistletoe improves the tolerance of chemotherapy and reduces side effects. That's just a short remark on that.
Thank you, Marion. And sorry, just giving you very little time here. And Klaus, can you say something about primary prevention?
Yes, the integrative medicine or oncology can be applied, of course, in primary care already. Now, I think that was a question if it's in a primary treatment already is implemented. And the patients comes to the consultation hour for integrative medicine either by their own demand and asking about it, or whether the treating oncologist had an impression that the patient could benefit. And we have patients where we start an integrative approach even before the chemotherapy to support the treatment way of the patient. So this is possible, and we do practice and realize that. Did I got that question right, or is there something missed?
No, I think let's leave it with this at this stage. Thank you, Klaus. And Thomas, can you say something about some of the more critical attacks against integrative medicine, and what's your experience?
Yes, I think if we look at the discussion we sometimes have in Germany, it's a discussion about evidence, and for us in the competence network, it is clear that we are all standing on the basis of evidence-based medicine. And a main argument sometimes heard in the public discussion is, would a complementary or alternative treatment delay a necessary life-saving treatment for patients with severe diseases like cancer. So in fact, most of the medicines and most of the nursing treatments and therapies in the field of complementary medicine, they are not dangerous in themselves. It's not toxic in general. They would not be on the market with the permission of the BfArM, my institution where I chair one of the pharma commissions. But the argument is often, could that not delay an important treatment? Would patients wait too long until they are treated? And that's why we feel it is so important to have this integrative approach. You can be sure that in none of our KIM hospitals there is a delay, because it's a full integration. It's the cancer care unit. It's the specialized unit. And even if sometimes patients may think, I would like to start first with complementary medicine, and then they could be late, we try to deliver a treatment where nothing is delayed, and where we can make sure that the full integration of the different therapies really works. And that's why I feel this is maybe the best argument that we need integrative medicine instead of something going on in parallel worlds.
Excellent. Thank you very much, Thomas.